Hello, this is Navdeep Yadav from group number 486, and the topic is about to patronage of the postpartum women. So, postpartum care, what is it? So, postpartum care can from soreness to discharge, and what to expect as recover from a vaginal delivery. So pregnancy can make many types of changes than you expect, and it doesn't stop when the baby is born. So here, physically and emotionally, expect from vaginal delivery changes may can occur. So like vaginal soreness. Vaginal soreness, it's mean delivery from vagina. It's mean vaginal tear during delivery, or it's mean doctor made an incision. The wound can hurt for weeks, and excessive tears may take longer to heal. It can take more time to heal, and heal. Then what should woman should do? Sit on a pillow. She should sit on pillow and cool cool the area with an ice pack, so it can make a wound heal, and use a squeeze bottle to pour warm water over the peritoneum as a passing urine, and sit in as a warm bath, and take take an over the counter pain reliever, and should take some counters like pain relievers which can provide to get relief from pain, and talk to healthcare if it, or take some laxatives to prevent constipations. And after that, vaginal discharge. So after delivery, it's begin to superficial mucous membrane that line your uterus during pregnancy. So vaginal discharge made up of the membrane and blood for the weeks. So the discharge will be red and heavy for the first few days. Then it will taper it later and become increasingly watery and change from the pinkish brown to yellowish white. And now contractions. So contraction might feel like occasionally occasionally contractions, and sometimes it's called after pains, and which often resemble menstruation cramps, also known as, help to prevent excessive bleeding by compressing the blood vessels in the uterus. It can uh, prevent the excessive blood by the contract of the vessels in the uterus. And the most common during breastfeeding is due to the release of the hormone oxytocin. And you uh, incontinence. Incontinence, pregnancy, labor, and vaginal delivery, can stress or injure pelvic floor muscles, so which can support for the to the uterus and bladder and the rectum, as you know. This might cause to leak a few drops of urine while sneezing or laughing, or at the time of the cough. It can pass a little bit amount or drop of the urine. So these problems usually improve within weeks, but persist its long term. And in the meantime, wear sanitizer pads should be wear, and pelvic floor muscle excessive, and that can help to the sorry that can help to prevent control bladders. And then hemorrhoids and bowel movements uh, pregnancy from can also make some hemorrhoids and can changes in the moment of the bowel, like pain during the bowel movement and feel swelling near anus and the part of the bowel movements. It's mean have swollen in the anus or lower rectum at the around part of the lower rectum. And apply so we should apply an over the counter hemorrhoids creamy and suppository containing hydrocortisone. Use sanitary pads which can hazel or a numbing agent soak in plain warm water which can for the time like 10 to 15 minutes for 2 to 3 times in a day it can better. And then can it can pregnancy can also changes in the tender of the breast, like few days after the birth you might it can experience full or firm land breast, like engorgement. Yeah, frequent breastfeeding on both breast is recommended to avoid the minimize engorgements. And pregnancy can also make hair loss and changes in the skin, and like mood changes. It can also make weight loss it can also occur in the after the part of after the postpartum delivery it can occur also. Thank you.